To prevent HPV infection, there are non-vaccine modalities. For example, decreasing the number of partners, the use of condoms, which is not 100% protective, but has shown 70% reduction in newly sexually active college women when their partners consistently use condoms. Condoms have been shown to reduce incident infection associated with a lower rate of cervical cancer and associated with regression of HPV-related cervical and penile lesions. Microbicides have been used, and of course, treatment of visible warts is another approach. Smoking cessation is also a very important part of prevention, as illustrated in the previous pathogenesis slides. So can we prevent HPV? Yes. Prevention consists of vaccination with a virus-like particle. The particle is non-infectious. It has no HPV DNA, but it does use different adjuvants. The efficacy of HPV vaccination is greater than 97% against CIN 2 and 3, vulvar and vaginal lesions, and greater than 98% against genital warts, and that's the quadrivalent vaccine. The formulations are shown here. There's a bivalent, which attacks 16 and 18, a quadrivalent, which attacks 16, 18, 6, and 11, and a nonavalent, which attacks 9 different types of HPV infection that causes approximately 90% of cervical cancers and 80% of high-grade cervical lesions worldwide. Vaccine recommendations for routine use is in 9 to 26-year-old women, even those who have had a history of an abnormal pap smear. Routine use of quadrivalent HPV vaccine in boys ages 11 to 12 years, a catch-up dose for males 13 to 21, and permissive use of vaccines in men ages 22 to 26. How well does the vaccine work? The 9-valent HPV clinical trial was the basis for the FDA approval of the 2-dose series. Let me expound on this. Among almost 1,400 participants, greater than 97.9, so almost 98% seroconverted to all 9 vaccine-preventable HPV types by 4 weeks after the last dose. For girls and boys who received 2 doses of the nonavalent vaccine 6 months apart or 12 months apart, non-inferiority criteria were met for seroconversion and geometric mean titers. Furthermore, geometric mean titers, or GMTs, were significantly higher for the nonavalent HPV types among persons ages 9 through 14 who received 2 doses compared with females ages 16 to 26 years who received 3 doses at 0, 2, and 6 months. How long does it last? Well, through 10 years of follow-up from clinical trials, no evidence of waning protection after 3-dose series of HPV vaccine has been found. Because antibody kinetics are similar with 2-dose and 3-dose series, the duration of protection is also expected to be long-lasting after the 2-dose series. So recently, the FDA approved HPV vaccine, which is also called Gardasil 9, for ages 27 to 45 years old. And the ACIP, the Advisory Committee on Immunization Practices, will vote on whether or not to extend the recs to include those up to the age of 45. Thank you for listening. I hope you have gleaned something regarding HPV infections.